Well, President Cyril Ramaphosa yesterday announced Cabinet's intention to lift the national state of disaster that came into effect 2 years ago after the coronavirus outbreak in South Africa. The President announced a number of eased COVID-19 restrictions. However, Ramaphosa says the country will remain on level 1 of the lockdown and warned that relaxing some regulations does not imply the end of the pandemic. Now, let's get a reaction. We're now joined by Professor Benjamin Smart, Director of the Future of Health and Medicine project at the Institute for the Future of Knowledge at the University of Johannesburg. Prof, thank you so much for your time this afternoon, and thank you so much for joining us.
Good afternoon, and good afternoon to the viewers.
Now, Prof Smart, the President in his address last night warned that relaxing some regulations does not imply the end of COVID-19. Some have called the move, though, inconsistent and incoherent. What do you make of government's recent announcement in relation to the fight against the pandemic? I mean, was this a wise move?
Well, I don't think the President is in a position to call the pandemic over, even if he wanted to. The pandemic is a global phenomenon. And it's certainly not over. There are hundreds of thousands of cases globally every day. We have come to the end of our fourth wave, and the effects on our healthcare system are minimal now. I think only a couple of people died yesterday, and that trend has been continuing for a while. So I think the President's right to warn that the pandemic isn't necessarily over. He's not in a position to do otherwise, but he was equally right to, weaken the lockdown restrictions and allow for our economy to thrive.
And those that say that, some of these recent restrictions are somewhat inconsistent and incoherent. If you look at, what we came from, 2 years ago, just recently, we know that only about 35% of people aged between 18 and 35 are vaccinated. We know about 40% of the adult population is also vaccinated. How do you think the ease in restrictions will affect vaccinations, especially if you consider primarily focusing on enhancing population immunity through vaccinations?
Right, well, there's two ways, really, in which the population can gain immunity. The first and preferable way is through vaccinations. And 30-odd%, 35% just isn't as many as we'd like. But there's, a large vaccine hesitancy problem in South Africa. And I suspect that, most people who want to get vaccinated and intend to get vaccinated have already been vaccinated. The other way is just through prior infection. And there's a very good chance that the majority of this country have already had one or another of the COVID-19 variants. And that in itself provides immunity, at least for a while. And so although only 35% of the population have been vaccinated, a much larger percentage of the population have immunity at this time, as we can see through the through the death rates and the harm that the disease is doing. It's just not doing anywhere near the amount of harm that the second and third waves did. So I think the outlook is fairly positive at this time. And although I fully expect there to be a fifth and a sixth and a seventh wave, I'm hoping at least that COVID-19 becomes an endemic disease, much like the seasonal flu.
And I'm sure that is what government is also hoping. And now, of course, as you've also said, we know more now about COVID-19 pandemic as we did, before, like 2 years ago. Now, as we head to winter, of course, there are concerns of that fifth wave, which some are saying is threatening. What kind of regulations should rather be enforced at this time, particularly if we consider high levels of immunity amongst the public that we have not reached as yet, and also as far as it helps to relieve the pressure on healthcare facilities?
Well, look, there's a growing consensus amongst public healthcare professionals that the restrictions aren't really helping that much. Hard lockdowns aren't particularly effective. Mask wearing, particularly outdoors, isn't particularly effective. The kinds of masks that South Africans wear, just these general cloth masks, are not really useful at preventing the spread of the Omicron variant, which is very contagious. And really the main point is that the Omicron variant in particular, and hopefully future variants, just aren't doing the damage that the previous variants were. And where that's the case, we should be less interested in the number of new cases as we are in the number of hospital admissions and so on. And even at the very peak of the Omicron wave, our healthcare system was able to cope. And I think, one has to be mindful of the effect of lockdown restrictions, no matter how minor. We now consider restricting 50% of people not attending football stadiums to be, that's quite relaxed. But really, that's still quite a strong restriction. That has a damaging effect on the amount of money that sports stadiums can make. And one has to be mindful of the economic and social effects of lockdown restrictions and balance that against the benefit that they provide. And at this time, healthcare professionals, epidemiologists have a general consensus that, lockdown restrictions just aren't worth it when you look at the cost-benefit analysis at this time.
Now, when you look at what is happening currently in China, where several of their cities are on lockdown currently because of those new cases that have come up, how worried should we be, especially if you look at the restrictions that have also been eased when it comes to our borders and our airports, etc. Just how worried are scientists when they look at those numbers that are creeping up for the first time in a year or so?
Scientists are not particularly worried. Okay, so there are many people in this country that are positive for COVID-19 right now. Letting in a few more at the borders does not have the same effect that it did in March 2020. In March 2020, there were no cases, or very few cases of COVID-19. So when one or two people sneak through the borders with COVID, that can have a material impact. But right now there are tens of thousands of people that are COVID positive in South Africa already. And so really, as I say, it's a matter of weighing up the costs and the benefits. And the benefits of opening up the borders in the way that we have for the tourism industry and for ultimately people's livelihoods and their ability to put food on the table significantly outweighs the cost of letting in a relatively tiny percentage of extra people with the virus. In terms of what's going on in China at the moment, yes, I expect that they have another wave, and I expect that we will have another too. But as I say, what's important isn't really anymore the number of new cases. It's the amount of harm that is doing. And one has to keep a closer eye on the number of hospital admissions and whether or not our hospitals can accommodate those. Listen, we live in a country where tuberculosis kills 60,000 people a year. At this rate, COVID-19 is going to kill far fewer people than that next year. So one has to consider the fact that this is going to be an endemic disease. This is going to be the new normal. And sooner or later, we are going to have to come out of a national state of disaster. We are going to have to get rid of as many lockdown restrictions as we can to promote the economy, to promote the livelihoods, and to allow us to get back to a normal way of life where we can socialize under ordinary circumstances.
Professor Benjamin Smart, thank you so much for your time this afternoon. Really do appreciate it.
Thank you.